Cardiovascular physical examination and semiology, key techniques and findings. In the realm of clinical medicine, the cardiovascular physical examination remains a cornerstone for assessing and diagnosing cardiac conditions. This detailed examination, enriched by the semiological approach, offers clinicians vital insights into the heart's function and potential pathologies. Semiology, the study of signs and symptoms in medicine, plays a pivotal role in interpreting the physical findings during a cardiovascular examination. This article aims to elucidate the key aspects and techniques of a comprehensive cardiovascular physical examination and semiology, providing practical and informative guidance for both medical professionals and students. Inspection and general assessment. The cardiovascular examination begins with a general inspection of the patient. Observing the patient's general appearance can offer clues about their cardiovascular health. For instance, pallor might suggest anemia, a common finding in chronic heart failure, while cyanosis could indicate hypoxia due to inadequate oxygenation, a sign of severe heart or lung disease. Pulse examination. Palpation of the pulse provides valuable information about the heart's rhythm, rate, and character. A regular, steady pulse is generally normal, while an irregular pulse could signify arrhythmias. The pulse's character, whether bounding or weak, can indicate the status of cardiac output and peripheral resistance. Blood pressure measurement. Measuring blood pressure is a fundamental part of the cardiovascular examination. Hypertension is a significant risk factor for heart disease and stroke, while hypotension might indicate heart failure or shock. The difference between the arm's blood pressure can suggest aortic dissection or significant peripheral arterial disease. Jugular venous pressure assessment. The jugular venous pressure, JVP, offers insight into right atrial pressure and, by extension, right ventricular function and central venous pressure. Elevated JVP can be a sign of heart failure, tricuspid valve disease, or pericardial tamponade, whereas a low JVP may be seen in hypovolemia. Precordial inspection and palpation. Observing and palpating the precordium can reveal abnormal movements such as a visible apex beat, which might suggest cardiac enlargement. The presence of heaves or thrills, palpable vibrations, can indicate significant valvular abnormalities or shunts. Auscultation. Auscultation is a critical component of the cardiovascular examination. Listening to heart sounds with a stethoscope can reveal abnormal rhythms, extra sounds, or murmurs. S1 and S2 are the normal heart sounds, while additional sounds like S3 or S4, or the presence of murmurs, can suggest heart failure, valve diseases, or other cardiac pathologies. Peripheral vascular examination. The examination extends to the peripheral vascular system, including the limbs and neck. Assessing for peripheral edema, varicose veins, and the status of peripheral pulses can provide further clues about cardiovascular health and potential systemic involvement. Integration of findings. Integrating findings from the cardiovascular examination with the patient's history and presenting symptoms is crucial for forming a differential diagnosis. For example, a combination of elevated JVP, peripheral edema, and a third heart sound, S3, strongly suggests congestive heart failure. Conclusion. The cardiovascular physical examination and semiology are invaluable tools in the diagnosis and management of cardiac conditions. Mastery of these techniques enables clinicians to make informed decisions and offer the best possible care to their patients. Understanding the nuances of this examination is essential for any healthcare professional involved in cardiovascular care. In summary, the cardiovascular physical examination, enriched with semiological insights, is a fundamental aspect of clinical medicine. It requires a keen eye, skilled palpation, and careful auscultation to discern the subtle signs that may indicate underlying cardiac pathology. This guide aims to empower healthcare professionals with the knowledge and skills necessary to conduct a thorough and effective cardiovascular examination, ultimately contributing to improved patient outcomes in cardiac care.